All right, I call this, where are my reading glasses so I can see what I want to ask here, but what is this? What's going on with me, Doc?
So what's going on is you have a condition called presbyopia, and that's basically the eye's lack of ability to focus. What happens as the eye gets older, sometime over the age of 40, you start to lose the ability to focus up close. So you can see great distance, but you lose that ability to see up close. Some people start, initially when it first develops, you start holding things further and further away, and eventually your arms aren't long enough. And to help that, you need a treatment to basically bring that focus back in.
I think God does that so we don't see our chin hairs.
Yeah.
But up to this point, what kind of treatments have been available for presbyopia?
Sure. Traditionally, the main treatment for presbyopia was glasses, reading glasses. Yeah, it works, but it's not ideal. A lot of people have glasses all over. They have them here and there, and you get them at the drugstore often, and it can be annoying. Beyond that, you can wear contact lenses. You can wear, let's say, what's called monovision, where you have one eye set better up close and one eye set for distance, and that can work, but some people feel a little off balance with that. You can do LASIK to simulate monovision with one eye distance and one eye close, and that can work. There's also treatments with cataract surgery where we can put a bifocal lens inside the eye. But some people say, aren't quite ready for cataracts and maybe don't want that monovision with one eye distance, one eye near.
Right. So in comes Kamra inlay. What is that?
That's right. So the newest treatment is Kamra inlay. What Kamra is an inlay that goes into the cornea to accomplish the goal of maintaining distance vision but bringing in near vision. And what's nice about it, can give you distance, intermediate, and near. It basically transcends all focus points. So basically everything seeing out of that eye becomes more clear, distance, intermediate, and near vision.
Is it done to just one eye?
That's right. So it's done to one eye. The reason being, the way it works, it causes what we call an aperture effect, kind of like a camera where you can bring down the aperture. So some people have heard of a pinhole camera, where a pinhole camera can allow for focusing distance, intermediate, and near. You don't need a fancy camera lens to bring in the focus. Same thing, the camera works with that same effect, the pinhole type effect, reduces light in and only brings the clear light to the back part of the eye. So if we were to do it in both eyes, it may dim the vision a little bit. So by doing it in one eye, we get that range of focus, and the other eye sort of maintains its distance vision and the full range of light.
So it's the camera effect that works on the near vision.
That's right, that's right. So that's why it's Kamra with a K, and so they're playing off that aperture effect.
So who can benefit from this procedure?
So basically, the people that can benefit, the people that have presbyopia, so usually people over the age of 40 that have lost that ability to see up close. Sometimes it's prior patients. Let's say we've done LASIK on patients that are 30 and they've done great, and they come in 10 years later and are like, Doc, I was seeing great distance near, and now what's happened? I can't see up close. Did the LASIK go bad? And we say, no, that's a normal process that the eyes go through, and people can add this on to previous eye surgery. So they can add it on to previous LASIK. If you've had cataract surgery and maybe both eyes are set for the distance, but now you want one set to bring in that focus, you can add Kamra on top of cataract surgery.
You bring up distance. Will it change your distance vision at all?
It maintains the quality of that distance vision. You might notice a little bit of a dimming effect as far as the light, so that's why you will only do it in one eye, but it maintains the acuity and distance and bringing in that near vision.
Let's say I'm 45 years old. I wish I was 45 years old, but I'm 45, I get Kamra inlay. How long is that gonna last me?
So we expect the Kamra inlay to basically last a lifetime. What's nice, a lot of treatment for presbyopia, let's say monovision, has a certain time effect. As the eyes continue to age, it might lose its effectiveness. Kamra, the way it works, since it's an optical principle, we expect those optics to maintain a lifetime. So even if you've had the Kamra inlay and then have other eye surgery, let's say cataract surgery, we expect it to work with cataract surgery, or other types of treatments. So
walk me through the procedure. What happens? How long does it take?
Okay, so the Kamra procedure takes around 10 minutes to perform, maybe less, maybe 5 minutes. It's similar to LASIK, where what we do is we create a tunnel in the front part of the eye, the cornea, and it's like a little tunnel with a pocket, and we insert a tiny lens that has a pinhole aperture in that. We insert that into the cornea. Once it's in position, the surgery's over. So basically it's a two-part process. First the tunnel creation with a laser, and then the insertion of the lens.
What's the downtime?
The downtime, patients are typically driving in the day after surgery, so you take, sort of the day of surgery, you take it easy. The day after surgery, you're back to functioning. we tell people as far as the visual recovery, it doesn't happen overnight. It takes a little time. The eye has to get used to seeing through this new optic, and so we tell patients to really not judge the procedure before 4 to 6 weeks. Most patients are doing quite well prior to that, but sometimes everybody heals differently, so it may take some time for it to completely heal in, but usually 4 to 6 weeks patients are functioning quite well.
Are there any side effects?
Great question. So, with any kind of optical principle, there can be side effects. So even, let's say, wearing glasses, you might see glare or halo out of the corner of your eye. Anytime we put a lens inside the eye or around the eye, there can be optical, aberrations from that. So some patients might notice driving at night, maybe a glare or a halo. Usually it's not too different than what they might have seen with glasses. Probably the biggest thing is it dims the vision a little bit in that eye because it's cutting out the blurry light rays and it's only bringing in the clear light rays.
When you say it dims it a little bit, is it very noticeable, or you won't really be able to tell?
Most patients won't be able to tell. We can simulate what it looks like. So we have a card that's called the Kamra card, and you can look through that and it can simulate what the vision's going to be like after the procedure, so that patients sort of feel what it's going to be like. Once a lot of the patients, as soon as they take that card, they look, they can say, gosh, doc, I can see the chart on the wall, I can read the chart up close, and they say, okay, this is what I want. If somebody says, well, it's a little dim, maybe it's not for them. So we try to simulate what it might be like for them.
You mentioned the short downtime, but if somebody is, very involved in sports, plays tennis or something, can they return to their normal activities right away?
Sure. In general, patients, could have this surgery on, let's say, a Thursday and playing sports by the weekend.
Will I be able to golf better?
Well,
because I can't
yeah.
golf.
If so, I'll probably get it myself as well. So we're all looking for that better golfing thing. But what is nice, some patients have monovision, and that can affect the golf game. It can affect the putting. With this, your distance, seeing the scorecard or seeing the putter, all those distances will be in focus, which is nice.
How much of an improvement can people see? Like, my glasses are 1.25.
Sure.
So am I going to get the same result as somebody who wears a 2.5?
Yeah, what's interesting, it transcends basically all reading power. So it can work for somebody that's in a 0.75, a 1.25, a 2.5, or a 3. So it works through all those reading glasses. So if you go to, let's say, a drugstore and see the different glasses on the shelf, that Kamra lens can take the place of all those reading glasses, which is nice.
That's very exciting.
Yeah.
Who's a candidate for this? Anybody?
So basically, the candidates are people that are having trouble seeing up close, that have basically healthy eyes. There are some things that may rule you out if there's certain eye conditions that may make you not a good candidate. So we do a full exam, make sure the eye's healthy and can tolerate any type of procedure. But basically, people that are having trouble seeing up close would be a candidate for this procedure.
You have done this procedure on people. What are they saying about it?
They love it. Nowadays, we're so dependent on near things. A lot of patients, the iPhone or their smartphone, they're so used to looking up close, and they're like, doc, I'll see them in the waiting room. They're like, doc, now I can see my phone, I can see distance. I myself, I just had to get the new iPhone 6 Plus. I'm thinking, now I've got something bigger. The camera, that type of thing will help me be able to see even the small print on these phones.
But we don't have to be ridiculed by our kids when we have the large font
That's
on our
right,
little
that's
tiny
right.
phone. From your perspective, what makes the Kamra inlay procedure different from all other procedures?
This is the first sort of corneal procedure, LASIK-like procedure that has an aperture that simulates a camera that the optical effect of that depth of focus we see with the pinhole camera. So this is the first aperture device we've seen in eye care, so it's really exciting.
That leads me to my next question. What excites you most about this technology?
What's exciting for me is, I see myself, I'm just starting to notice some blur up close. I'm thinking, what's the procedure for me when I'm gonna need, I haven't started needing reading glasses yet, but I can see it's around the corner. So I look at it, it's exciting for me as a potential treatment. I have some friends that are ophthalmologists that were in the study, and they actually flew, when I say they were in the study, they were working with patients through the FDA, and they were so excited about the technology. They saw how happy their patients were. Prior to approval, they flew over to Japan to get it put in their eye. So if my friends that are eye doctors, that are my colleagues that saw the patients, if they're getting it in their eyes, I'm thinking, that's a great endorsement for me or for my patients. So I'm terribly excited about it.